occult blood test. A fecal occult blood test, FOBT, looks at a sample of your stool, feces, to check for blood. Occult blood means that you can't see it with the naked eye. Blood in the stool means there is likely some kind of bleeding in the digestive tract. It may be caused by a variety of conditions including polyps, hemorrhoids, diverticulosis, ulcers, colitis, a type of inflammatory bowel disease, or Crohn's. Types. There are 3 main types: Bueck smear test, fecal immunochemical test, flushable reagent pad. In a Bueck smear test, you collect 3 stool samples, smear on the card, and send to the lab. Color-changing chemicals detect the blood. And in a fecal immunochemical test, you collect 1 to 3 stool samples, smear on the card, and send it to the lab. Antibodies detect blood. In the case of a flushable reagent pad, you place a pad in the toilet 3 days in a row. Pad changes color if blood is detected, and one can record the results themselves. So, indications. The most common indication for fecal occult blood tests are anemia, concern for gastrointestinal bleeding, and colon cancer screening. It can also be used to help to discriminate between irritable bowel syndrome and inflammatory bowel disease, which is likely to yield a positive test result. So how is the test done? Today I will be mainly elaborating on the Bueck smear test. So how that is done is the fecal occult blood test requires the collection of 3 small stool samples. Usually the samples are a bit of stool collected on the end of an applicator. The stool samples should be taken 1 day apart because colon cancers may bleed from time to time rather than consistently. The stool samples are collected in a clean container and evaluated by detecting color changes on a test card or by sending the samples in a special container and envelope directly to a doctor's office for analysis. Preparation. How should a patient prepare for this? Because certain foods can alter the test results, special diet is often recommended 48 to 72 hours before the test. The following foods should be avoided during that time. No raw fruits, no raw vegetables, no red meat. You can eat chicken and pork. Less than 250 milligrams per day of vitamin C enriched foods or beverages in the 72 hours leading up to the test. That will be all for my presentation today. I hope that was clear and helpful.